Well, good afternoon, everybody. My name is Garrett Schmidt. I'm the managing editor and CEO of VBC Exhibit Hall, and I'd like to welcome you all to today's live webinar hosted by Salient Health, and it is titled What Your Data Can Really Expose, How Incremental Changes Add Up to Extraordinary Opportunity. And this is a very interesting topic. I've had the privilege of getting a little bit of a preview, so I think you guys will really enjoy the presentation today. A few items of note, some housekeeping stuff before we get started. Everyone has joined today in listen-only mode. This is a traditional webinar format, so you don't need to worry about turning off your mic or your camera or anything like that. We can't see you, but we do want to hear from you. We're going to have a time for some Q&A towards the end of the presentation. And so if you have a question at any point for our speakers, please drop that into your attendee module. There's a place specifically for questions. We're going to get to as many of those as we possibly can, excuse me, during the allotted time. If we don't get to yours, though, for some reason, don't worry. Someone will reach out to make sure we answer your question via email later on. Also, the session today is being recorded, so what's going to happen is after we're done, maybe about an hour or so after we conclude, you will receive an email, and there will be a link to the recording as well as to the slides from today's presentation that you can download. And that way you can listen to it again at your leisure or share it with colleagues and friends, and we hope that you do. And that is, I think, it for the housekeeping. And so without further ado, I wanted to introduce our speakers today. We have with us Mr. Sergio Wagner, and he is the Chief Strategy Officer of Salient Healthcare. And we have Tiffany Staples, and she is the Vice President of Marketing. So welcome, you two.
Thank you.
Thank you.
Awesome. So we really want to make this very informative, but also somewhat interactive for you as well. So we're going to start with a poll question, and this is just something for you, the audience, to kind of think about and to answer. So the question is, what type of data are you currently tracking that's essential to your organization? What are you using the most? So is that clinical data, provider data, pharmacy data, social determinants of health data? You can choose all that apply, and we'll give you just a couple seconds to get those results in.
Great, and I've pulled that up on your screen, so you should see that. And this is anonymous, by the way, and we will show the results so you can see where you stack among your colleagues. So we'll just give it another few seconds for the results to come in. Okay, I think looks like most people have voted, so we'll give it another 5 long seconds, and then we'll shut it down. So 5, 4, 3, 2, and 1, and I'm going to go ahead and share the results. All right. Sergio, are you able to see that?
Yes, I can.
Awesome. Well, this really kind of gives some insight, and this is great for Sergio and I to see, especially as we continue on in the presentation, but it really looks like clinical data and provider data are what's being tracked the most within your organizations that you think is the most beneficial for you. And interestingly enough, those social determinants and the pharmacy data kind of might be lacking a little bit, as well as there were two that mentioned that there was something else. So that's really interesting. We'll continue to kind of look at this as we go along in the presentation, but now we'll turn it over to Sergio, and he will get right into it for us.
Thank you, Tiffany. So, a couple of interesting things, right? So, clinical data and provider data. So, as the poll showed us, the collective we, for our respective organizations, are constantly paying attention to a set of data and actually growing our respective data sets. You know, it is interesting, worth noting that by 2025, the volume of healthcare data alone will grow at a rate of 36% annually. Just to give you a little bit of point of reference, the average hospital generates about 50 petabytes of data annually. That includes clinical data, records, imaging, genomics, et cetera, et cetera. It is also helpful to sort of begin to frame these things in some context, because I find that usually helpful. So a growth of 36% annually by 25. What does that mean? Well, if you think about next two sectors that follow it, The financial sector, which produces not an insignificant amount of data, is scheduled to grow at a rate of 24% a year, and the retail sector by 27%. So that tells you a very interesting thing. So let's go to the next slide and talk about the types of data in healthcare. So these are the big data categories. So it is interesting to see, obviously, most of us are always paying attention to clinical data and provider data. And that is very, very important. But that's not to say, and there's some different aggregations and annotations as to how we might think and categorize those data sets. But when I think about all of the data that we at some point may want to pay attention to, it isn't just clinical and provider, which is by far not insignificant and quite important. But I would also consider there to be claims that pharmacy, which I think people mention, as well as social determinants. But we need to start also paying attention to operational and utilization data. Public health sector census data is one of my recent, well, not recent, less than recent sort of insights. It's an amazing amount of insights that you can actually get from census data when you combine it with other data sets, as well as genomic and behavioral health. It is interesting to note that this data set is ever growing, and just because it is ever growing, we purposely left off dental data. I am a big proponent of making the dental data set to be all-inclusive inside of the healthcare data set, simply because of the fact that there's some not an insignificant amount of correlation between dental data and diabetes. But as we think about all of these data sets, right, it'll be pivotal and important to always think about how to interrogate and cross-match these data sets, because data for the sake of data, having it is pretty, it's sizable, but we need to do more. So, but before we get there, all of those data headlines sound pretty cool, or maybe not, but how do we access this data today? It is no secret that I am a very, very huge supporter and proponent of TEFCA. You know, TEFCA provides a national network framework for data exchange that ultimately enables standardized, secure, and scalable access to healthcare information across various systems and organizations, right? This not only facilitates better interoperability, but also accelerates the ability to integrate data from multiple sources, like QHINs and other networks. You know, data aggregators also are a way to get and access this data and play a crucial role, because one of the things that they also do is they blend the clinical, the claims, and the SDOH into a comprehensive data set that oftentimes aims to give us a 360-degree view of patients. And ultimately, by leveraging TEFCA and the ability to access some of these data, it allows us to, or allows organizations to gain timely access to critical insights that are aimed, hopefully, to reduce care fragmentation and ultimately drive better decision-making process. All of this, and we'll get into some of these nuances of the intersection of data access, and the ability to make data insightful and useful. All of this is obviously provided that we have the right tools to not only query and interrogate the data, but improve patient outcomes by driving continuously operational efficiency. That was a mouthful. So let's go to the next slide. So if that's the case, then why is data so important? We keep talking about data and access to data and insights to data. Well, data is crucial to the health care risk-bearing organizations. That was an interesting bad pause. Because when I think about these models of care, I think about enabling accurate risk assessment, predictive insights, and informed decision making, which are essential fundamental pillars for managing cost, improving care quality or quality of care, and optimizing for financial outcomes, which at the end of the day are aimed at driving the better management of a patient and their needs, the ability to effectively stratify the risk associated with the patient so that we are effectively able to benchmark them or benchmark their care as it relates to them specifically, but also them as a population, and think about positioning the patient at the center of every single decision-making process. So if we go to the next slide and we talk about the ways in which we want to use this data, access, and the insights of what data could tell us. Let's talk about this. A recent study from McKinsey estimates that $300 billion in annual savings could be achieved in the US healthcare system by using big data effectively to drive both efficiency and personalized care. Sounds like a mouthful. Let's break that down a little. So 300 billion is a big number, but let's give it a little context. So in 2021, the healthcare spend in the US accounted for 18.3% of our GDP, gross domestic product. Same year, the GDP for the US was $23 trillion. So we spend significantly more than most developed countries, most of the European nations and some comparable nations to that of the US in terms of economy size and scale, relatively speaking, spend between 9 and 12%. Now, why is this important? So as healthcare interoperability and efficiency improve, it is natural to expect a reduction in the total addressable market in certain sectors. So obviously, if we'll save 300 billion, that'll come from somewhere. This is because increased data integration and streamlined workflows and the more effective use of resource allocation can reduce redundancies and inefficiencies that have historically driven a higher spending and resource utilization. That to say, that doesn't simply mean that there's going to be a decline in an opportunity, but I think of this as a sort of a transformation, right? Where the focus will move from solving inefficiency and issues to advancing patient outcomes and driving innovations. And I think that the market as a whole will reward solutions that create lasting impact and transform the delivery of care into a more efficient and scalable model. I want to pause here for a second and see if you guys have some questions, because this is a very important slide with me. It is for those of us that are both in business, healthcare, the healthcare of business, patient care. There's always going to be an interesting intersection between efficiencies and taking some top of the total addressable market. But it is also worth noting that as we shrink and get more and more effective, we're bound to spend less. So it is important for us to think about those things because are going to ultimately drive what happens next in healthcare.
So if you'd like to ask a question, or if there's kind of something that you'd like to ask that we've spoken about already, please go ahead and use that questions tab up there on your tool. And you can go ahead and chat that in, and we can hope to answer those questions. I think Garrett will help us to let us know if there's any questions. If not, we'll move on to the next section.
All right, I think people are scratching their heads and waiting for the big finale at the end to ask their questions. So we'll keep moving on for now.
No problem. But we did want to make it interactive. So if at any time you do have a question, feel free just to chat that in, and then Garrett will interrupt us. So we'll go ahead and move on. Sergio's done a great job of giving us really that background that lets us know kind of what data is available to us within healthcare. So we want to move on to how can you actually use this data? How can we leverage that data to really utilize it so we can affect change within our clinical, our operational, and our population intelligence, and really give us some information to move that along and to optimize that fully. So if we're looking at kind of the what ifs, I call this the what if slide. So what if we actually had the power to make changes that really mattered? So what if we could actually quantify a dollar value that impacted us from reducing hospital readmissions? What if we actually use data to drive an initiative that decreased 30-day readmits? What could that do, not only for our operations, but for our patient population? What if we encouraged prescription adherence among specific disease prevalent populations? And what if we truly understood the impact of our chronic care initiatives on chronic conditions. There's so many what ifs that you can answer when you have the right data. So we're going to have Sergio walk us through about 3 scenarios just to kind of give us a feel for what impact can the data really make, what data are we going to use, and what are those benefits. So I'll turn it over to him. Here you go, Sergio.
Thanks, Tiffany.
Mhm.
So 3 use cases. Again, the purpose of today is we go through these sequences, I want you to keep in mind, I doubt that we're going to tell you anything that is earth-shattering or hugely insightful. Or at least I hope that we do. Um, Everything that we're going to tell you are things that probably will make you go, well, yeah, these are things I know. And one of the contexts of what we want to position the conversation today is to, if we can get you thinking about data, and if we can get you thinking about how to basically get the most out of as much of the data that you have or you might want to go get, I think that'll be, it would have achieved the goal in my hand. So let's talk about annual wellness visits. So when I think about these use cases, we're going to show 3 use cases, none of them which are brand new or groundbreaking, nor should they be. But we'll view them from the lens of the data and the data that's needed to use them effectively. And also, once you deploy them, um, what can we actually glean from these processes in terms of both a clinical and a financial outcome, which to me are the sort of the trifecta. It's what data do you need, and in doing so, how do you enhance that data set that you started with, and what are the clinical and financial benefits stemming from it. So the annual wellness visits, as we all know, it's a use case that leverages a structured visit for Medicare beneficiaries that focuses on preventative care, personalized health planning. Um, and let's begin by essentially looking at the data types that are needed to and will be enhanced ultimately as a subset of that visit. As the guy wearing glasses with the screen, I can't kind of not see everything that's there, but obviously we want patient demographics and medical history and a whole set of the total set that ultimately makes the chart as complete as possible in terms of vitals. To me, one of the most meaningful things is not only the risk assessment, but also the functional assessment. Especially for our aging and ailing Medicare population, the functional assessment and the ability for them to move around is going to be important. But these are all of the data types that you'll need to effectively conduct or have your organization conduct a very well-defined annual wellness visit. And as a subsequent measure of that, all of these data sets will then be enhanced by the actual visit itself. Now, the clinical benefits of performing this visit are fairly well documented. And again, it's not only the detection and prevention, the improved patient engagement. Patients tend to love these visits. I mean, it tends to be north of a 45-minute visit. So it is the one time a year when they feel that the doctor or their healthcare provider or practitioner is actually really there for them. So I mean, the patient scores as it relates to this encounter has been phenomenal to watch the trajectory upwards. And definitely improve chronic care management and chronic care disease. The financial benefits are pretty well aligned as well, right? When we talk about a general cost reduction through preventative care, as well as the Medicare reimbursement associated with the actual visit and the scoring of risk assessment factors so that you or the organization is adequately capturing the disease burden of not only the patient but the population so that uh, you are adequately compensated for caring for that population. I'd like to now transition to the next use case, which is network leakage. Never really liked that word. Doesn't have a good connotation. Always thought of the network inefficiency, right? And as a former healthcare administrator, this is one that is near and dear to me because I've spent a tremendous amount of time thinking about these things. So a couple of disclaimers. Obviously, this point of the conversation as it relates to network leakage falls outside of the second opinions, which obviously are oftentimes needed and traditionally at a network, or a network not having a specialty within network. So this doesn't equate for that, but network leakage basically is a use case that addresses the problems of patients leaving the healthcare network to get services that could have otherwise been provided by your network, oftentimes leading to loss of revenue, and not to mention fragmented care. To combat this, it is crucial to identify patterns where the leakage or inefficiency occurs, enabling healthcare organizations not only to retain more patients, but also optimize care delivery. And let me show you some of the data points, because these are very interesting. When we think about network leakage, to me, this is the perfect combination of both the clinical and an operational data sets. When combined, you'll need all this data to understand it, but these actually are very, very meaningful, because before we even get to some of the clinical benefits and the financial benefits, which we'll talk about, I often found these to be very, very insightful in terms of when I think about provider referral patterns. This is something that ultimately this gives, it's a treasure trove of data. Combining these data sets has always, when I was at some other health system doing some of this work, I found this to be very exciting or very insightful in terms of to understand provider referral patterns, to understand also contracting models for providers, where, for instance, if I see that 80% of the referrals are going to this one provider versus another provider, you can use those to effectively drive contracting schemas. So it isn't just about being effective and money making. These two things also do have clinical benefits and financial ones. So if you go to the next slide, you'll see the benefits of these solutions by improving patient retention. We've all heard the constant, I was going to use the word complaints, I wanted to use a better word, of essential patients saying that it's getting harder and harder to navigate the healthcare ecosystem. So if you think of a well-coordinated network where you are keeping everything in network, but the patient feels like they are in a I'm going to use the term medical home without walls, the patient retention will be drastically improved. Not only enhancing care coordination, care management, reduction in duplicative services, and ultimately better health outcomes, but also in the financial terms, aimed at revenue retention and improved contract negotiations and cost reductions. So it is important to, again, things we already know. It's taking some of these very finite processes and these data sets and applying them very specifically to a workflow so that you can, to drive a desired outcome of whatever your organization may want to do. I'll close out by showing you the third one. Third one is chronic care management. Right? Chronic care management is a process that focuses on providing care to patients with chronic diseases like diabetes, COPD, hypertension, etc. And the goal is simply aimed at improving patient outcomes while reducing the unnecessary healthcare costs through proactive care coordination and monitoring, as well as management. So rather than do the same spiel of showing you data types, we can just unload, flip them all at once, rather than just go through the section. These three things, in terms of the data, the combination of the data and the clinical benefits, are probably one of the most effective tools in terms of sort of curbing the healthcare spend. The data in and of itself, it's probably one of the more, outside of the network leakage, it's one of the more robust ones in terms of clinical management, because it encompasses both the clinical data set as well as the claims data set and some utilization, hospital, and has some cross-functional models of data that you'll want and need to effectively manage this. But the benefits are not only meaningful in terms of the clinical, but also the financial one. And they are not applicable just to the healthcare system as a whole, but even the practices, right? When you consider the CMS allows you to bill for the chronic care management under CPT codes 99490 and 99439 and receive reimbursement for non-face-to-face management. It's just an effective way to manage these things. So in closing and in summary, as it relates to these 3 use cases, what I would like to take away, or we hope take away, is is there is an almost overabundance of data that is being thrown at us left and right. The healthcare system, the healthcare ecosystem continues to produce data and variations and different data modalities at an unprecedented rate. It is important for us, or for you, to think about the workflows and the processes that are most meaningful to you, whatever those may be, and then think very methodically about the data that you'll need and how to effectively use and interrogate that data to essentially drive the two more meaningful things in healthcare, which are clinical benefits and then financial benefits. Tiffany, I think it's your turn to ask the question.
It is my turn, and I'm going to ask you for a little bit of audience participation. So we have another poll question. So thanks for sharing those scenarios with us, Sergio. So our poll question is, do you currently have the data you need to address challenges like those in the last 3 scenarios that Sergio shared? So absolutely, sort of, kind of, nope, or I have no clue what you just talked about.
All right, as before, you should see this on your screen, and just want to go ahead and take a minute to answer this question. And again, this is anonymous, so don't worry. But we're going to show the results here shortly, so you'll be able to see kind of what your colleagues said as well. So we'll give it another few seconds here as we've still got some answers rolling in. And we will close it down. Looks like most people at this point have responded. So once again, I'm going to give it about 5 long seconds. 5, 4, 3, 2, and 1. And I'm going to, oh, someone always comes in right at that last second. Oh, another one. All right, well, here we go. We're going to shut it down and show the results. There it goes.
Awesome. Well, that's interesting. That's what we actually should pretty much expect. So it looks like many of you don't really know necessarily where to get the data or may not be able to actually access it. For those of you that are doing really good with it, the 8%, sounds like you're set. Don't worry. The person that says, help, I don't know what we're talking about, I got you.
I love that. That was my favorite answer.
And if you don't have the data, obviously, we can talk more as well. So thank you so much for giving us that insight. That really helps to kind of continue to share. So moving on from that poll question, thanks again for participating. We're going to talk a little bit about being data-driven. So what does that really mean? That really means adopting an efficiency mindset. So thinking about using data for every single thing that can affect change within your organization. How can you do something better? How can you achieve something that you've been looking to achieve, a goal or anything like that? And how can you do that in the most effective way possible? So adopting that mindset is key to really improving quality versus just quantity. So we want to use that data to really uncover any vulnerabilities or optimization opportunities within our current processes. And then we want to use that data. When you really become a data-driven organization, you're going to take those insights that you have and you're going to share that organization-wide. Because not only do you need that data, but so do other people within different departments to optimize your entire organization. You should be able to take that data as well to create actionable lists that really are going to bolster or add value to your current care management strategies. They might even help to create those care management strategies. And then you'll also use data to really understand the impact of realizing those goals within your organization. So why do they matter? Why are you doing what you're doing? And how will that change your organization or change the care quality or change the care that you can provide? So on to Sergio.
If you see giddy, it's because this is the one slide that Tiffany allowed me to put in the entire deck that I actually liked. Not that I don't like the other ones, but this one spoke to me. because I mean, and I'm speaking to the one person that says, I have no idea what you're talking about. And I love that. Because sometimes I feel like I'm the one who's like, did everything just pass me by? So if you take anything away from this webinar or from this time that you spent to us blabbing what you guys were doing emails and doing the many, many other things that you have to get done, think about this. If I refer you to that slide 4 where I give you this incredibly long list of all of these data and data sets that might be available, um, think about what that question meant for you. You as a person, you as an agent of your organization, and it doesn't really matter how many resources you have, because if you don't know how to use them effectively, it'll never be enough. So I would say take the two sets of the two polling questions, and think about what that means to you, and what that means to your organization, right? Um, it'll always be cool to have more data. It'll always be cool to have more toys, more insights, more tools, more analytics. But maybe we just need to figure out how to use what we do have already. So I invite you to think about those things. Um, and here comes a shameless plug. No, I'm kidding. One of the things that I was thinking about this is reports suck. I hate reports because oftentimes, even as someone who is in a position where reports are made for me, I didn't make the report. So sometimes I don't have the benefit of interrogating the data myself, because sometimes a report is a stagnant moment in time that aims to answer a question that honestly wasn't really asked by me. Um, I know someone that says, who will do what by when? Well, we need to apply that same methodology to interrogating the data. So it is important to think of a tool or to think of a model of work that actually allows you to have the data sets and to ask the questions that you needed, so that it is ultimately addressing those things that you as an organization care about. Maybe it is an annual wellness visit. Maybe it's not. Maybe it's chronic condition management, or maybe it's transitions of care. I don't know. Whatever the answer is, think about data that you'll need and think about the tool to make that data actionable. Because at the end of the day, it's about that. So with that being said, I believe that the next thing is an open-ended Q&A. And listen, I know that we booked an hour, and I pride myself on giving you almost half of the time back, though I am happy to answer questions.
Hey, no one's ever complained that a webinar finished early, that I'm aware of. But no, great. We do have some audience questions, though, and so we're going to get to as many as we can. So if you do have a question for either of our speakers, go ahead and drop that in now into the to the question module, and we're going to get started with this one. Aggregating data has been a challenge for us, and we find ourselves segmented, different departments coming to the table with conflicting information. How is this approach different, and what do you suggest we do to solve this issue?
Join a QHIN. So I don't participate in a QHIN. I mean, I will. So again, I think at the risk of recommending someone by name, because I don't want to do that, right? I think that DEFCA and DEFCA is a very important mechanism by which organizations, I will say, like Care Quality and Commonwealth and QHINs, can ultimately play a pivotal role in that by allowing you to query data set that oftentimes goes through some sort of patient matching index and data aggregation model, so that the data that you ultimately consumed is aggregated, normalized, and deduped. And that may ultimately do away with a lot of the issues that you may find, because oftentimes, historically, different pieces of the organization have sourced data from different portions, which is, it is essential to have a data aggregation strategy at the center of it all.
I think another piece to that is really making sure that you are sharing that information across the organization, kind of what I spoke about on that data-driven slide, really ensuring that you are sharing what you have to share. and that it's being used throughout the organization. Because if there are discrepancies, if there is information that is different, you are really able to look into that and to interrogate that fully.
Wonderful. All right. Next question here is ROI has always been a challenge to overcome when getting budget for data initiatives. Some have worked, some have failed. How can we use the data itself to prove ROI for leadership?
Oh, so while I spent some time at a very notable institution in Palo Alto, I've spent a lot of formative years in Silicon Valley. So listen, you're right. No one gets budget for anything or buys anything if you can't demonstrate an ROI. So to me personally, the ways in which I have often used ROI is to show I'm a big fan of transitions of care. I'm a big fan of chronic condition management and ways by which you can actually use and quantify data to show, listen, this is how I can make you money, this is how I can save you money, and or ideally do both. So one of the things I'd like to do, or I have done in the past personally, while wearing different hats, is listen, if you give me this tool and if you give me the ability to have insights so that I can drive this, I will do, maybe it's a 5% reduction in hospital frequent flyers. Maybe is ensuring that every single one of my patients has a transition of care, or maybe it's securing an ADT data feed. An ADT data feed is oftentimes a very useful tool set at admission, discharge, and transfers. It gives you insight into transitions of cares. It gives you insight into frequent flyers. I would use a data set that you could very crawl, walk, run. Big data sets and ginormous data sets are cool. Start with something small like ADTs. I mean, start something small like things like that should be able to quantify a very, very demonstrative return on investment.
Great. Okay, moving right along here. Next question here is, we are a smaller ACO and haven't really started using our data yet. Where or what data sources do you recommend we start with?
Well, as an ACO, obviously you'll have the claims data set. That would be a gimme. I would personally be an interesting proponent of connecting to an organization like a Care Quality or Commonwealth or one of the KeyLens, which would give you additional data. In an ideal world, I would use my claims data. I would use access to clinical data and some social determinants of health data to give you a really complete picture, depending on what the initiatives, again, back to the previous questions, depending on what initiatives you are focusing on. Don't get data for the sake of data.
Gotcha. Okay. Next question here is kind of a statement and a question. So see what you think. Is smaller practices are better at keeping patients out of hospitals than large ACO practices. Why is the health system consolidating? And maybe do you agree with this statement?
Listen, I do. I live in the Bay Area, and when I started my career, there were probably they were very, very meaningful and probably defunct now defunct organizations like CATG, California Association of Physician Medical Groups. We have seen a tremendous amount of aggregation in healthcare. Private practice is very hard. Private practice is very tough. I think that there is a number of factors that ultimately collided into that. I agree with you that an independent practice in a physician is incredibly adept at keeping a patient out of the hospital, but also the economic reality. If you look at I live in the San Francisco Bay Area, you're either Stanford, Sutter, or Kaiser. That's it. Those are your options. 20 years ago, I'm dating myself, but 20 years ago, you have many more options for independent medical groups and or practice associations that are just not the case today.
Yeah.
So I'm
True.
not answering your question. I'm basically agreeing with you.
No, that's yeah. I think it was mostly a statement. Um, okay, next question here is one poll question response mentioned they have data but can't access it. What is the solution for that problem?
I would invite the follow-up question because I'm not really sure what that means. I mean, if you have data but you can't access it, to me, it means that you don't have the proper querying tool to drive insights out of that data. That would be one interpretation. I am representing Salient Health after all. But honestly, outside of that, a different interpretation to that question could mean that you may have some access to data that may be for treatment purpose, and you may not be in a position to give that data use an additional one, such as insights or analytics. I'd love to take that question and take it offline because I think there's a lot of insights into that.
Yeah, very good. Very good. Well, I think that is actually it for the questions that we have, unless someone else has one as we're wrapping up here. I know there is, as many of you know, live, there is a big storm bearing down on Florida. And so I'm sure a lot of you are planning for that and trying to get ready in that. So our thoughts are with you there. And so we'll give you a little extra time to do that today. So we will end early. But as we conclude, first of all, Sergio, Tiffany, I wanted to thank you for a fantastic presentation. There's a lot there, and of course, we're going to give you all the recording and also a link to where you can download the slides. So you will receive that via email here soon, probably within the next hour or so. Is my estimate. As we conclude, though, I wanted to encourage you all to head over to VBC Exhibit Hall and check out the Salient virtual exhibit booth that's there, and you can learn and read up on them and kind of what they're doing in the space, and even contact them through there and really just educate yourself on there. And there's also a lot of great educational solutions in our archive library if you're wanting to learn more about any of these topics and subjects. So head on over to bbcexhibithall.com. And if in conclusion, if you would like to reach out to either of our speakers, to Sergio or to Tiffany, their information is here on this final slide, or feel free to reach out to me as well. I'm happy to facilitate an introduction if that's easier for you. But again, thank you, Tiffany. Thank you, Sergio. Thank you all for spending your afternoon with us, and hope you have a wonderful day and join us on the next one. Thanks so much.
Thank you.
Everyone.